This video will provide an overview of public health professionals in Canada. Public health practitioners work towards ensuring a healthier society by addressing emerging health issues, improving population health, and shaping the public health priorities in Canada. Public health professionals include a variety of practitioners, such as frontline service providers, consultants, inspectors, and specialists from a wide range of backgrounds such as public health, population health, health promotion, epidemiology, biostatistics, nursing, medicine, bioethics, behavioral sciences, social sciences, and many more disciplines. Public health professionals also work in a variety of public and private settings. They can be found at all levels of government, including at the municipal, provincial, territorial, and federal levels. They may work at community clinics, health service centers, public health agencies, non-governmental organizations, or at academic institutions. Alternatively, they may consult or work for profit organizations and corporations. Public health professionals can be directly involved in improving the health of the general public, or they may be indirectly involved through working in administration, monitoring, surveillance, planning, evaluation, education, research, or academia. Public health professionals often perform their activities in interprofessional teams. They collaborate and engage with patients and their families, health professionals, administrators, community members, stakeholders, and partners to successfully carry out their work. Public health professionals vary in their training and academic backgrounds. Some complete training as registered health professionals, while others receive bachelor's degrees with specializations in public health or health studies, finish research-oriented or professional master's degrees, or complete doctoral training. Other public health professionals may receive certification after a combination of training and field experience. Next, we'll describe some of the clinical and non-clinical public health professionals to demonstrate the various roles that practitioners take on to strive towards greater public health. There is a long history of health professional engagement in public health and health promotion in Canada. Nurses working in clinical public health positions provide services in primary care, community health centers, public health, home care, or in the school system. They play critical roles in health promotion and surveillance, disease prevention, emergency response, community development, and education. Nurses with public health training may also work in administrative, policy-making, or decision-making roles within the government or professional associations. They may be involved in the design and implementation of public health programs or hold academic positions in which research and education activities focus on public health topics. Next, public health physicians focus on preventing illness, promoting health, identifying the health needs of the population, developing public health programs, and contributing to health policy and decision-making. They may work in clinical practice, academic settings, non-governmental organizations, or health administration. Public health physicians are involved in governmental organizations at the federal, provincial, territorial, and municipal levels. The Chief Public Health Officer is responsible for public health nationally, while Chief Medical Officers of Health lead public health at the provincial and territorial levels. While having a clinical background provides a unique skill set that can be readily applied to the field of public health, individuals with non-clinical backgrounds are also well equipped to work in the field. With a Master of Public Health degree, public health practitioners gain a clear understanding of the social determinants of health and how they underpin all health and wellness. Recognizing this interconnectedness equips these individuals to work in a variety of areas, tackling multidisciplinary health issues like tuberculosis, cancer, mental health, and addictions, for example. Public health professionals can also practice in the field of evaluation. Various types of evaluations can be conducted depending on what public health programs or services need to be investigated. The role of evaluators focuses on the planning and design of evaluation activities, project management, data collection, data management and analysis, and reporting and knowledge translation activities. Evaluation results are then used in decision-making regarding program funding, expansion, termination, or modification. Next, epidemiologists use their knowledge of the distribution of disease and the determinants of health in their work. They may take on various roles to assess population health, monitor health behaviors or diseases, respond to outbreaks, as well as to plan, implement, and evaluate public health programs. To aid in their work, epidemiologists may collect information and conduct data analysis to identify trends and forecast future states. Epidemiologists may also be involved in the surveillance of infectious diseases, chronic diseases, and injuries. Lastly, public health researchers study various public health-related topics to better understand issues affecting the health of society, including health behaviors, risk factors for disease, and patterns of healthcare use. They may conduct qualitative or quantitative research studies, literature reviews, or evaluate the effectiveness of intervention programs. Researchers are often involved in the knowledge translation of their findings to academic and non-academic audiences. Their work contributes to evidence-based decision-making and informs health policy, resource allocation, and funding decisions. The work of public health professionals is guided by the core competencies for public health in Canada. In order to align public health work to consistent standards across various practice areas and organizations of public health, 7 core competency statements overviewing 36 core competencies were developed in the country. These competencies encompass 1. Public health sciences, 2. Assessment and analysis, 3. Policy and program planning, implementation, and evaluation, 4. Partnerships, collaboration, and advocacy, 5. Diversity and inclusiveness, 6. Communication, and 7. Leadership. That was a brief overview of public health professionals in Canada.